Thank you. Technical support. Thank you very much indeed. A very warm welcome to this afternoon session. The theme of our discussion is about probing the pandemic. Ladies and gentlemen, what I will try to do is, before inviting all the eminent speakers, starting from Madam Commissioner, and then the Honorable Minister, Deputy Minister of Health, and the President of Pan-Hellenic Pharmaceutical Organization. Let me use my academic role, my professorial role, and try to introduce to you and give you a picturesque or a visual impression of the discussion that took place this morning. And please allow me just to provide a brief glimpse of how probing has been developed, what are the challenges, what are the problems, and what is the future. And in doing so, what I would really try to do is to use evidence. Evidence coming from the World Health Organization, evidence coming from The Economist, evidence coming from the OECD, and evidence coming from the European Commission. So there are two important issues that we have to address, is to assess the response of national health systems, and we have the Minister here, in anticipation, I would say, Mr. Kodosamanis, and the vaccine history that we will discuss extensively. Here we provide a brief roadmap on how probing has been developed. We have the first wave where we had an exponential increase on the pandemic. We have the second wave where an impact on resources we had to discuss. Then the third wave, which was the interrupted care in chronic conditions and the NCDs. And then the fourth wave that we envisage and is in front of us with a considerable impact on trauma, mental illness, and psychological disorders. Very quickly, we can see here the four waves of the new confirmed cases. And then next to this, we can see the deaths that have been recorded on the base of the World Health Organization. And as we can see, deaths in the first wave were proportionally much higher in comparison to the rest of the waves. And here is what I found from the studies conducted by The Economist, because since this is The Economist meeting, we have to draw some attention and some references to The Economist. And The Economist highlights the so-called normalcy index. The 100 is the way that we lived before, and the depth is what we have lost because of the pandemic. And we can see in the first wave the greatest depth, and then the impact that has been with regard to cinema, recreation, flights, and very little in terms of the family because we stay with our families. And we can see that China is first, then USA, and the rest of the countries. But one important impact that we haven't discussed, and is the silent figure behind the pandemic, is the impact on anxiety and depression. These are the OECD data, and then focusing in Greece, what we can see is, and what we expect, is a 5 times greater increase in anxiety, depression because of the coming COVID-19. This is something that I'm sure the Minister and the Madam Commissioner will discuss on this. And then here we have what we can summarize from all these morning discussions, the evolution of GDP in Greece before the crisis, during the crisis, the economic crisis, and during the COVID period. And we can say that in terms of the COVID period, the quarterly data highlights a 17% reduction on our GDP. And comparing COVID with economic crisis, we haven't envisaged that much such a decline in our economic growth. But luckily, as Theodoros Kyriakakis, the minister, mentioned before, there is a roundabout, and then it's something is coming up that we're going to achieve a better economic growth. And drawing some criteria from this morning discussion, we analyzed three major components, three major criteria with regard to the crisis. The first is the duration of the crisis. We had the 10-year crisis, which no other country across Europe and the rest of the world envisaged. And now, all of a sudden, we confront another COVID crisis. Then the second component and the second criteria is the depth of the crisis, is to what extent we lose the floor under our foot. And then in terms of the depth, we can see that COVID severely hit the Greek economy by 17%, whereas in the greatest part of the crisis, the reduction was just 11%. And resilience, which was important component, economic and health resilience, and the minister will discuss further on this as well as the commissioner. Here we have the fully vaccinated people, and we can see ourselves in Europe, how well we are and how well we stand, because Greece is much higher from the average, which the average is about 36%, and in our country we have achieved 39%. And I think this is a remark that you would also discuss. And then with regard to our commissioner, to Madam Commissioner, we can see that Europe is far better, 3 times better than the rest of the world. Here is an element from the research that we have conducted in the University of Athens, and we can see the assessment and the satisfaction that they have, the different age groups, with regard to the vaccination program. And the elderly that they have been already vaccinated, they assign a very high value in the success of the vaccination program, and then the younger population, they have some sort of reservedness. And then here, coming towards to the end, and inviting the commissioner, Madam Stella Kyriakidou of Health and Food Safety, I have taken some crucial keywords out of her speech. One is in terms of vaccination, safe and effective. The second one is equitably Europe. We had Schobler discussing about efficiency, but equity, the European values, is a crucial component into our own European policies. Permanent strategy for COVID-19, pooling resources, economic efficiency and pooling resources is very important. And I just recall, no one is safe until everyone is safe, and we will leave no stones unturned, I like this expression, in our efforts to protect EU and global citizens. Ladies and gentlemen, let me introduce four eminent speakers. First, Madam Commissioner Stella Kyriakidou for Health and Food Safety, European Commission. Then the alternate Minister for Health Services, Vasilis Kondozamanis. George Yfantopoulos, who will join us from United States of America. And then Theodore Trifon, who is the President of Pan-Hellenic Union of Pharmaceutical Industry. And turning first of all to Stella Kyriakidou,